The International Rescue Committee is warning the Ebola outbreak is even larger and more advanced than official numbers suggest. Medical teams have confirmed more than 300 cases across the Democratic Republic of Congo and Uganda. And now officials are warning the true number of cases could be much higher and growing fast.
I'm sighing on my own today. His name is Peter Stafford. He is an American physician. He's been working at a hospital in Bunia in northeastern Congo since 2023, treating patients, doing the work. Last week, he became the patient. So he's now the first American confirmed infected in the worst Ebola outbreak the world has seen in years. And most Americans have no idea this is happening. And so here's what else you need to know. That the agency that is supposed to protect you from exactly this moment has been gutted. And the country that is supposed to lead the global response walked out of the room. So we really need to practice facts over fear and follow the science. So there have been 17 outbreaks in the DRC since 1976, 17. And we chose right now to fire our disease investigators in the United States. So I'm Dr. Ida Brown, and Dr. Sonia Sloan's not available today. We are EYA, Black and Brown Women Disruptors in Healthcare and Beyond. So what is happening with Ebola, and where do we stand as the United States? The same country that walked away from the WHO, stripped the CDC, and whose health secretary actually spent the last year firing the people whose entire job was to stop this. Let's roll the clip.
We cannot and will not allow any cases of Ebola to enter the United States.
So on May 15th, 2026, the Democratic Republic of Congo officially declared its 17th Ebola outbreak, right? We said 17. 17. So let's just let that sit for a moment. The first known suspected case was a healthcare worker in Ituri province with fevers, hemorrhaging, vomiting, intense malaise, and that worker died at a medical center in Bunia. So if you think about that, a healthcare worker, one of the people on the front lines protecting their community, that's the person who died of Ebola. So that same day, May 16, 2026, the World Health Organization declared that this outbreak is a public health emergency of international concern. So that's PHEIC. That's the highest formal alert in the global health system. So I want us just to talk about the fundamentals, right? Ebola is a viral hemorrhagic fever. It's a severe systemic illness that causes organ failure, and in many cases, it causes death. And the death typically begins with symptoms that look like many other illnesses, right? High fever, intense headache, profound fatigue. You get some muscle and joint pain. But as it progresses, the vomiting, the diarrhea, the severe hydration, and in some cases, the hemorrhagic complications happen. And that's where you get internal and external bleeding. And so without aggressive supportive care, Ebola can cause multi-organ failure and death within days. And here is the most important thing to understand about how Ebola spreads. It is not airborne. I'm going to say that one more time. It is not airborne. You cannot contract Ebola by passing someone in a grocery store, riding public transit, and breathing shared air. The transmission actually requires direct contact with infected bodily fluid, such as blood, vomit, sweat, saliva, or contaminated surfaces and burial materials. So Ebola is significantly, I'm going to say it again, significantly less contagious than COVID-19 or even measles. But when the transmission does occur, the consequences can be devastating, even fatal. Let's roll the next clip.
With the US, we collaborate at all levels, expert level and high level. We share information, and they're also investing, they're supporting financially. And I know they will increase their support. There is strong commitment at all levels, and I'm really glad to see that. So for the response, I think that's the most important part. With the rest of what they're doing, I think based on their risk assessment, they have, they can do whatever they think is right for them.
So, I want to make sure that our listeners understand that this isn't the same Ebola that we've seen before. There are multiple strains of Ebola, and most people are familiar with that Zaire strain, and that's the one that drove the catastrophic 2014 to 2016 West African outbreak. And for that strain, we have an approved vaccine, RVSV-ZEBOV. The brand name is Arvivo, and it has been a critical tool in outbreak control. But this outbreak is called by Bundibugyo strain, and there is no approved vaccine for that strain. And so this distinction really matters because the outbreak went undetected for weeks, and in part, it's because the initial laboratory tests were designed for the Zaire strain, so they came back negative. By that time, Bundibugyo was confirmed. The virus had already established community transmission, right? That's a problem because case fatality rates in the two previous Bundibugyo outbreaks ranged from 30 to 50%, right? So that 3 to 5 out of every 10 people would die from this disease, right? 30 to 50%. Now, there have only been 2 prior outbreaks, one in Uganda in 2007 to 2008, and then one in the DRC in 2012. So luckily, multiple vaccine candidates are now being fast-tracked. The WHO has recommended prioritizing 2 monoclonal antibodies for clinical trials and is evaluating the antiviral Dosavir as post-op exposure prophylaxis. But on May 17th, we talked about how the WHO declared this as a public health emergency of international concern, and that's our highest designated global public health. So we have these alarming statistics where only 7% of these known contacts have been successfully traced. And contact tracing is actually how we break this chain of transmission. So if only 7% are being detected, we can't break that chain. We're running way far behind it. And then the troubling part is that approximately 20% of the confirmed cases are healthcare workers. So let's explain why that's a problem, because when healthcare workers become patients, the entire response infrastructure weakens, right? Who are going to take care of these people if the healthcare workers themselves are ill? So there are fewer people to staff these treatment centers, there are fewer people to conduct contact tracing, and there are fewer people to take care of the sick. So this is what an outbreak acceleration looks like. So the other thing that we really need to notice is that before we talk about what the United States is doing right now, we have to talk about that the US dismantled before this outbreak began. So that context is not a background, it is the story itself. The CDC's disease detectives, as we noted, those who were trained to do this were fired. 135 of them, this Trump administration fired, half of the unit, and they're gone. And those are the ones that would have been in the Ituri province. Those are the people that break the chain before the virus boards the planes, right? But it didn't stop there. The CDC has proposed cuts of 53%, which drops the agency's budget by $4.3 billion. And that's thousands and thousands of CDC workers that will no longer be with the CDC, all while we're facing this outbreak. So the Morbidity and Mortality Weekly Report, which is a publication that actually tracks disease outbreak in real time, its entire editorial staff at the CDC was fired. And so a virologist at the University of Saskatchewan said it plainly after the March 2026 layoffs, quote, "The CDC will have lost its ability to detect outbreaks and respond to them. It will no longer be able to track diseases in America and around the globe. And that includes infectious diseases like flu, foodborne illnesses, and Ebola." End quote. So this is not a political opinion. That's a structural assessment from a scientist who does this work. And so then, of course, we have the WHO. So if you remember, we've talked about this a few times, that on January 22nd of this year, 2026, the US finalized its withdrawal from the World Health Organization. Now, the United States helped form the World Health Organization back in 1948. So for 78 years, the US was the leading donor. In the last full biennium, we contributed $1.28 billion. We had seats at every table. We had access to every early warning system. And we had active participation in every global coordination call. But now we have none of that. In fact, the United States still owes the WHO more than $130 million. But we walked out of the door anyway. So here's what that withdrawal means for this specific Ebola outbreak. According to CNN, the Trump administration's cuts were four-pronged. You had withdrawal from the WHO, dissolution of the USAID, cutbacks at the CDC, and reduction of health aid to the DRC and Uganda directly. And aid workers on the ground said those cuts, not the virus, but the cuts are what hampered the early response. And, this is a detail that I think should stop everyone cold. It's been reported that the U.S. disease researchers were even restricted from participating in the WHO Ebola response coordination calls. So the few detectives that remained could not be part of the coordination of our response. And the directive actually limited participation to a maximum of 3 people. Three people. And this is for an outbreak with no approved vaccine. One staff called it unheard of during a U.S. response to emerging public health emergencies. And the WHO's Emergency Contingency Fund, which is the mechanism that was created after the 2014 West Africa outbreak, specifically so that the response could be very fast, it's only received $5.4 million in total donor contributions in this year. The U.S. used to be the largest donor to that fund. So we didn't just leave the room, guys. We took the chairs with us and part of that table. We are not there, but we still are choosing to follow these facts over fear. And then, of course, run the next clip. It's at our airport.
Gowns, gloves, and masks to protect workers. These are the kind of supplies and support international aid organizations mustered to control previous outbreaks. But in the past 3 years, aid from Western countries has shrunk dramatically, in particular as the Trump administration shuttered the U.S. Agency for International Development and cut funding to the World Health Organization. In 2024, U.S. funding to the DRC was at $1.4 billion, dropping to $451 million in 2025 and $146 million this year.
So you guys, this is a problem, right? Because even now, in Dr. Sloan's hometown of Houston, their George Bush International Airport's one of the 3 airports in the United States that's been designated to screen airline passengers traveling from the African countries that were affected by Ebola. And this is all right before FIFA, right? The World Cup is coming. It's here in a short number of days. And the DRC soccer team is scheduled to play here. And it's also anticipated to be some of the largest gatherings in the major cities in this country. And remember that Dulles Airport in Washington, D.C., as well as Hartsfield at Jackson Atlanta Airport are the other 2 airports that'll be screening passengers from the DRC, South Sudan, and Uganda. And folks actually are supposed to fill out a questionnaire, and from that, it's decided whether they have a fever or whether they've had a recent fever or not, and when they'll be self-monitoring. And so those that actually have the symptoms are supposed to be then contacted by a CDC public health officer. But remember that the CDC staff has been cut dramatically. So just important to note that we still haven't had a confirmed Ebola case that's here in the United States, but remember that this doesn't mean that there's no risk. And I want everyone to recognize that it's not that we really don't have the money, right? We just only committed $80 million in medical aid to the outbreak. And I'm glad that there was some money that was spent, but $80 million looks like not much when you see the numbers that we've already been talking about on this show. As a reference, we found $630 million for military pre-strike buildup and before a single congressional vote happened, right? Under 72 hours. So it's imperative that we're able to restore some of the funding to the CDC. So what I wanted to share was just that this public debate about Ebola, it always is whether we should keep it or stamp it out. And the public health practitioners actually know that this is a false choice because we have to control the source as well as fund the testing and surveillance and strengthen our vaccine campaigns. We have to improve our health infrastructure. And the WHO has really led that in the past, and we have defunded it. So what our call to action is that should Americans actually be worried? Should they be concerned? Yes, right? That's an appropriate clinical and civic response. Should we be panicked? Absolutely not. The United States still has a very sophisticated infectious disease infrastructure, and what remains of it is still good. Our border health surveillance is active, and the biocontainment hospitals are on standby. So screening is live at those 3 designated airports. So there's currently no evidence of community transmission here in the United States. But we want you to do 3 things. 1, if you know anyone that's traveled to that area in the last 21 days, they need to call their healthcare provider, call the CDC. Do not go to the ER or urgent care. Number 2, you need to understand the transmission of this. It is not airborne. You cannot get it from being on a flight. You can't get it from the subway. So knowing how it spreads actually helps to prevent spreading misinformation that's already circulating. And then 3, we really want to be mindful about racial profiling at screening checkpoints. So if you witness or experience that, you want to contact your ACLU. And just to say that Peter Stafford, he went to Bunia to help people. And he understood something this moment is asking for all of us to understand, is that infectious diseases do not respect borders, politics, or zip codes. So here, we want you all to stay informed, stay vigilant, and stay loud. We are AYA, contributors to the MeidasTouch Network, and proud members of the Midas Mighty. Please subscribe, like, share, and follow, and keep the truth out loud. Thank you.
Want to stay plugged in? Become a subscriber to our Substack at MeidasPlus.com. You'll get daily recaps from Ron Filipkowski, ad-free episodes of our podcast, and more exclusive content only available at MeidasPlus.com.